Hello, everyone. My name is Brittany Overall, and I'm the Education Supervisor at the Georgia Poison Center. Today, I wanted to discuss poison prevention, especially when it comes to COVID and some of the things that we are seeing here at the Poison Center. So we'll first start talking about who the Georgia Poison Center is, and then we'll move into 3 poisons in our homes that we're seeing an increase in surrounded COVID-19. And these potential poisons include cleaners and disinfectants, hand sanitizers, and medications. The Georgia Poison Center is one of 55 centers nationwide. We're the only one in Georgia, located in Atlanta, but provide our service to the entire state. We're also certified and accredited as a regional poison center by the American Association of Poison Control Centers, known as AAPCC. They are the governing body that develops the national standards and certification process that ensure the quality of poison emergency services. They also run the centralized database for poison centers nationwide, which compiles toxic exposure data in cooperation with all poison centers. The Georgia Poison Center is housed at Grady Health System and operates under the supervision of the Department of Pediatrics of Emory University School of Medicine. We've operated the 24-hour Poison Emergency Treatment Information Service since 1970, providing assistance and expertise in the medical diagnosis and management of human and animal poisonings. We were designated the official state poison center in 1976. And some of our services include the Poison Helpline, Drug Information Center, and Public and Professional Education. We're also the training site for healthcare professionals and serve the state by coordinating outreach and education programs to increase awareness of poison prevention. As mentioned earlier, we service the entire state of Georgia, from Valdosta to Young Caris and to everything in between. So this is over 10 million people. We're the 8th most populated state in the U.S. And this map to the right shows the number of calls we get from each county. And as you can see, majority of our calls come from the metro Atlanta area, which isn't surprising since those are some of our largest counties in the state. We're also one of the busiest poison centers in the country, receiving nearly 85,000 calls in a year. The Georgia Poison Center is staffed with a dedicated group of highly trained professionals that include physicians, toxicologists, nurses, pharmacists, and other healthcare professionals. So we do not have operator number 1, 5, or 8. We have highly trained professionals that we like to call SPIEs, which stands for Specialist in Poison Information. These specialists are available 24 hours a day, 7 days a week to provide free treatment advice through our 1-800 number, our chat function on our website, or by email. We can also help in more than 150 languages through our translation line, and we also utilize the Georgia Relay Service for hearing impaired. So if you look at our calls for 2019, we had over 75,000 exposures. And an exposure is when you have an actual or suspected contact through the mouth, nose, eyes, or skin with any substance regardless of its toxicity. And majority of these calls come from the general public via our 1-800 number, web chat, or email option. And then 27% of our calls come from healthcare professionals like doctors' offices, emergency rooms, or EMS. And then we also receive close to 10,000 information calls, and these are more of a question or curiosity, meaning no exposure or potential exposure has occurred. And this could be a question about a drug-to-drug interaction or if it's safe to take a certain medication while pregnant. When we think of a poison, we define it as any product or substance that can harm someone if used in the wrong way, by the wrong person, or in the wrong amount. And these potentially poisonous substances can be found all around us. They can be found in any room of the house, like the garage, the kitchen, the lawn, the garden, or even play areas. And so this list gives examples of things that could be potentially poisonous, from medication, chemicals, drugs of abuse, or home products for the everyday use. And there are a lot of medications listed, and as we all know, medication is a remedy that helps treat, prevent, or relieve symptoms of an illness or disease when it's taken correctly, so by the right person and the right way and in the correct amount. but any medication can cause harm if it's used incorrectly, and that would be by the wrong person or in the wrong amount. So most poisons happen when someone swallows something harmful, like my child ate this, or I accidentally drank that, or I took too much medication. But you can be exposed to poison in other ways as well. Sometimes people don't realize all the reasons why they can utilize the poison center. Poisonings can occur through the eyes, for instance, when a liquid or spray product gets splashed or sprayed into the eyes. Another way is through the skin. So many products like pesticides, oven cleaners can be harmful if they come in contact with your skin. And then we can't forget being bitten or stung by an insect or snake. And then we can also be poisoned by breathing in a chemical or substance. And a popular example of this is breathing in carbon monoxide or fumes from a strong chemical in a room with no fresh air or ventilation. With all the changes we're making in our lives with social distancing and COVID, it's important to talk about poisoning. The majority of poisonings happen in the home, with about 43% of our calls to the Georgia Poison Center from children under the age of 5. With social distancing, majority of us are at home, including our kids, and so we've seen an increase in use and access to household products. We're using our cleaners more and our hand sanitizer more. Parents are trying to multitask by helping their kids with school while trying to work. So there's an increased stress and distractions. There may also be a change in our routine and lifestyle. So instead of waking up at 5 to get ready for work, we're now waking up at 6. And this may cause us to take our medications at different times or even forget. And then lastly, there are rumors and misinformation about how to prevent the spread of the virus. And all of these are some of the reasons why we're seeing an increase in poisonings at home during this time. Cleaners and disinfectants have always been a common poison that we get called about. Household cleaners are the second most common call we get for all ages and the number one most common call for children less than 6 years old. Kids are curious and may want to spray the bottle, or they may even think that the cleaner is juice because of the bright colors. According to the National Poison Data System, there were 11,967 disinfectant exposure cases reported to the 55 poison centers from January 1 to May 17th in 2020. This is a 62% increase as compared to the same time period last year. It's great that we're using these products more diligently to help stop the spread of the virus, but we may be misusing the products or not properly storing them. We may be mixing the products that could cause a toxic gas, or we may leave these products on the counter that a child can easily get to. Bleach has become something that we're all seeing an increase in calls about. Bleach can be used as both a sanitizer or disinfectant, depending on the concentration level, surface contact, or usage. This chart is data reported to all 55 poison centers from January 1 to May 17 in 2019 compared to 2020. There's been a 39% increase in bleach calls from this time last year to this time now. And this increase may be due to not using the correct ratio when using this product or mixing the product with other chemicals. So whether we use bleach, alcohol, or other products, it's important to use them safely to reduce the risk of a poisoning. When using these products to disinfect our house, it's important to open windows and ventilate the room, wear gloves if possible, carefully read and follow label directions, and make sure we're diluting the product correctly. Do not use cleaning products on food or body surfaces, which poison centers have received cases where bleach was used on the skin directly as a COVID preventative. And lastly, it's important to understand signal words on the products. So caution means slightly toxic, warning is moderately toxic, and danger is highly toxic and can cause permanent damage. This is a great graphic on how products shouldn't be mixed. All of these are products that we like to use or are now forced to use to keep our homes clean and free of germs. Some products can cause coughing, breathing problems, burning, and watery eyes, especially products like bleach, ammonia, and hydrogen peroxide. So if you're needing to mix these chemicals because you're not able to find certain products in stores, be sure to do your research first and call us with any questions you may have. And remember, bleach is a friend to no one except water. Bleach shouldn't be mixed with other products. Storage is important when it comes to preventing a potential poisoning. Remember that there's no such thing as childproof, so it's important that we store household products and medication properly. We should keep these items up and away and out of reach and sight of children, preferably locked up. We should also not store cleaning products near our food items, and we should not transfer these products into unmarked bottles. We've received calls from people putting these products in cups, water bottles, or buckets, and then a child or adult mistakes it for something that they can drink. We've also seen from the pictures here that a lot of our cleaning products look very similar to water or juice that we all like to drink. So it's important to be mindful of what we're doing with these products and who may have access to them. So now if we look into hand sanitizer, this is something we're all using a lot more of and are trying to find in stores. As with bleach, we've seen an increase in calls by 39% with ages 0 to 5 being the biggest culprit. The concern with hand sanitizer is the amount of alcohol it contains. Now, a lick off the hand isn't much to worry about, but if it's swallowed, then a child may experience some of the same symptoms we would see if they drink alcohol like a beer or wine. And often, hand sanitizer isn't stored properly. We keep it in places that we can easily access. When using hand sanitizer, we only need a dime-size amount, and we need to make sure it's rubbed in completely. It's also important to monitor children while they're using this product. We need to be careful with it potentially splashing or spraying into the eyes or rubbing our eyes after use. Safe storage is also important, so keeping these items up and away and out of reach and sight. Many of us love the small bottles that can clip onto book bags or diaper bags, but we need to be cautious with these. They're great to have around, but kids may be drawn to them because of their colorful look, or they have their favorite character on them, or they even smell good. So now moving on to medication. When we talk about medicine in general, we know that when there's a change in our routine, there's an increase in medication errors. So if we're doing things out of the normal, like waking up later or going to bed earlier, we could accidentally take our medication twice, or we may not remember if we've already taken it. Additionally, we're seeing people taking more or new medications or supplements. And as we mentioned previously, the added stress and distraction is a concern. Sometimes we see poor communication between parents and caregivers. Maybe one parent was supposed to give the medication to a child, and maybe they gave it to the wrong child or in the wrong amount. Or one parent gave it to a child and then the other parent gave it to that same child shortly after, not knowing that they had already had it. As with cleaning products, medication needs to be stored safely. It should be kept in its original container, up and away and out of sight, and locked up if possible. We've seen where family members have accidentally taken someone else's medication, so trying to store those in a separate area if possible. It's also important to read the pill bottle each time to make sure it's yours or you're giving it to the correct person and the correct amount and at the correct time. And then if medication needs to be stored in the fridge, try to keep it away from food items and on the top shelf. So we also encourage individuals to keep track of what medication they're currently taking, whether it's 1, 5, or even 10 medicines. It can be done in different ways. Some people may track it on their phone, but here's an example of a way to track it on paper. So it's important to know the name of the medicine, what it's for, when you started taking it, how often you're supposed to take it, and how much you should take. And try to keep it up to date and carry it with you. It's also important that we read and follow the labels for the correct dose and timing of any medication that we're taking. And the label gives us a lot of useful information like active ingredients, what it's used for, any warnings, as well as the dosage. So many medications have the same active ingredients, especially pain relievers like acetaminophen or Tylenol. And with this, we see accidentally double dosing. So for instance, someone may take a pain medicine for arthritis, and then maybe they have a cold and decide to take a cold medication that has that same active ingredient in it as their pain medicine. So at that point, they're getting 2 or more doses of the same ingredient. So if you're unsure if you can take certain medications with another, give us a call and our specialist will be able to help answer that question for you. It's also really important to handle medicine safely around children, to model the correct behavior, and to take medicine responsibly. Children learn by imitation, so it's important to not take medicine in front of young children, and we should never call medicine candy. It's also important to use the measuring device that comes with the medication. If you do not have one, you can always ask your local pharmacist for one. And we do not recommend using a kitchen or household measuring spoon as they all vary in size and you do not know the true amount that you're giving your child. We should also talk to our kids about medicine safety, teach them not to put things in their mouths, or if they find something on the ground, what to do with it. So I think it's important that we briefly address the COVID remedies and treatments that we're all hearing about on the news or in social media. We're getting our fair share of calls about potential medications, supplements, and remedies for COVID-19, but there is currently no FDA-approved medication, vaccine, supplement, vitamin, or other remedies for COVID-19. And it's never recommended to start or change a treatment without the instruction of your healthcare provider. On our website at georgiapoisoncenter.org, we do have a COVID-19 page. Here you can sign up for alerts and receive information and recommendations from local government officials through our Punch Alert app or text messaging system. We also have links to the CDC and Georgia Department of Public Health, as well as some general information, older adult prevention guide and infographic, press releases, what you should know about chloroquine and hydroxychloroquine, and a 10-minute video of frequently asked questions and answers. So please remember that we are here for you. We're open 24 hours a day, 7 days a week. We do not take a break even during this pandemic. And we encourage you to call and speak with our specialist if you have a question or a poison emergency. It's free and confidential, and you'll be speaking with one of our nurses, pharmacists, doctors, or other healthcare professional. And by calling us, we can help you avoid any unnecessary trips to the doctor or emergency room. Here's our contact information, our 1-800 number, and our website. And we're also on Facebook and Twitter, and we encourage you to follow us and like us at Poison Center GA. So here's a call to action. Take out your cell phones, open up your contacts, and save the poison helpline in your phone. Remember, the number is 1-800-222-1222. So don't wait for something to happen. If you have it in your phone now, you have it ready for when you may need it. You can also use Alexa and Siri to help in dialing the Poison Center directly. So thank you so much for your attention and listening to this presentation. Here's my contact information. I hope you found this presentation helpful. Feel free to reach out to me directly for any additional information. And I encourage you to visit our website and social media platforms to learn more. I hope you have a wonderful day and stay safe.